Our healthcare system is under significant stress, more than at any point during the pandemic.
It is something that Alberta knew was coming. After weeks of very high daily case numbers, COVID-19 patients are now arriving in hospital in need of care. There are currently 241 patients, 186 with COVID, now in ICU.
That is easily the most ICU patients that we've ever seen in our healthcare system, and definitely higher than what we've seen in waves 1 and 2.
The system has space for up to 425 ICU beds. The problem is finding staff to support them.
For us to be able to redeploy staff to ICU, we've had to reduce our scheduled surgical activity in some communities by up to 30%. This has a significant impact on those Albertans who are waiting for non-urgent scheduled surgery.
Late last week, Alberta Health began reporting the total number of ICU patients on its website. As the number of COVID patients seen in red increased, the percentage of non-COVID patients fell. That's because the province has already cancelled some non-urgent surgeries. But as of May 14th, intensive care units were more than 93% full. Fortunately, the number of new daily infections in Alberta now appears to be coming down.
The good news is we're very close to the peak of ICU. We just don't know when it's going to be, and we don't know what the number will be. But clearly, it will most likely be higher than we are now, and this is clearly at a peak that we've never been at before.
It's why the province is putting new contingency measures in place. In previous waves, a field hospital was built in Calgary and at Edmonton's Butterdome. The sites have never been used and remain ready. Still, AHS now has plans to build 2 more. Heather Yourex-West, Global News, Calgary.